is a global tel-link prepaid call from a patient at a Maryland rehabilitation center.
This is Serial, one story told week by week. I'm your host, Sarah Koenig. For the past month, I've spent every working day trying to figure out how two average strangers could have walked through the same unassuming PT door one day and leave for the hospital together, one almost dead and the other unscathed. I'm not even a detective or a private investigator. I'm not even a doctor. I'm just a physical therapy student, so let's set the scene. It's Baltimore, early 2018. Winter struck full force this year in a sort of bomb cyclone, the likes of which no one had seen before. Aisha, a 28-year-old woman, was running late to a PT appointment and slipped on the icy walkways. Luckily for her, Adnan, a 38-year-old man, was there to brace her fall as she slipped backwards into him. It wouldn't be the last time that they helped each other out.
Hello.
Hey, Aisha, this is Sarah Koenig. How are you? I called Aisha to get the scoop on what her first impressions of Adnan were. She started with the slipping on ice story. Apparently, she caught herself in such an odd way, with her thumb completely bent back against her forearm, that it sparked conversation between the two. After he helped her up and through the door, he asked if she was a double-jointed gymnast or something. Aisha laughed. She told me she was used to people dismissing her excessive joint motions as humorous. So your first interaction with Adnan was him politely poking fun of you?
Yeah, I guess you could say that. He seemed nice enough. I just don't like when people think that just because I can fold myself in half, that it's a cool party trick, you know?
Well, is it a party trick?
No, it's a medical condition. It's called hypermobility syndrome, and it hurts a lot.
Okay, gotcha. My apologies. So this hypermobility syndrome, let's call it HMS. That's why you were there that day? That's why you met Adnan?
Yeah, my rheumatologist wanted me to see a physical therapist about the consistent pain I've had for over 5 years in all my joints. I couldn't even turn a doorknob without excruciating pain. So it was a good thing Adnan had been there to open the door for me and to catch my fall. That was nice too.
So someone else sent you to physical therapy? Shouldn't you just keep seeing a doctor for that?
My rheumatologist suggested it after testing that I had had HMS. She suggested taking anti-inflammatory drugs like ibuprofen to manage the pain, as well as tricyclic antidepressants, which are commonly prescribed for fibromyalgia. Fibromyalgia often accompanies HMS, so I started taking those as well. My doctor also told me that even though it was a genetic connective tissue disorder, I would probably still benefit from physical therapy, so that I could start getting back to things like running and martial arts that I enjoy doing so much.
Yeah. I took some time after our phone call to figure out what exactly HMS was. I mean, could I even trust Aisha's information? I just assumed she was double-jointed, and if so, it seemed a little strange that she just happened to be in the physical therapy office that day. Turns out, HMS is realer than I thought. In fact, 10 to 15% of the population is estimated to have it, although the research on it was pretty scattered with the exact prevalence rates, so I guess I'll just have to take Aisha's word for it. But women do tend to have it a lot more often than men do. In fact, it comes at a 3-to-1 ratio. It also tends to run in families, so there definitely is a genetic component to it. I guess Aisha has both of these things going for her alibi. Are you tired of flabby abs and don't have time to exercise? Don't do boring regular sit-ups. I've discovered an amazing product that has transformed how I get toned abs. 6-Pack Abs Abdominal Stimulator is an amazing product, and it's so easy to use that you're going to get results in the first 2 weeks. You just stick them on and turn on the remote, and that's all there is to it. All you need to do is go to their website and enter the promo code SERIAL, and you will get 10% off this amazing product. Check it out. You can just read your book, sip your water, and get amazingly toned abs with no work. The physical therapist who I interviewed for this product did not wish to comment on this product, but I think it's great, and I don't have to do anything to get the abs I want. Now, back to the podcast. Welcome back to the podcast. I decided to go visit Aisha to get some more information. I wanted to know more about that day and to get a better understanding of what hypermobility syndrome really looks like, as well as to get some more information on what she knew about Adnan. All right, Aisha. So what can you tell me about Adnan? Did something seem off right away?
He seemed fine. We were both there for physical therapy, and that doesn't really strike me as like an emergency setting or anything. And he was only a few years older than me, so I just didn't think that anyone like us would really have a life-threatening disorder or disease going into physical therapy. We sat down and talked a little bit about our pain, and he definitely the whole time was really fidgety. He was just moving around a lot, shifting his weight, and I could tell he was just really uncomfortable. We both talked about how we loved running, and we both had to stop because of our pain. My pain's mainly in my shoulders and my wrists and my knees, and his is in his low back.
Okay.
But the conversation died off pretty quickly after we talked about that, just because I've been so tired lately.
Have you not been sleeping well or something?
Yeah, I'm not able to sleep well. I have headaches and I have a lot of pain. I also bruise really easily all over, and so it's hard to get comfortable in bed. My doctor said that it's called ecchymosis, and he said that a lot of people with my disorder bruise really easily, and they also have slow wound healing.
Okay. I wondered with her significant lack of sleep and apparent fragility if she was really the best key witness to talk to. So I decided to try and get information straight from the source, Adnan. I had been denied phone calls a few times before from the staff at the Maryland Rehabilitation Center, but I figured I might as well try again. Finally, a call came through to me.
This is a global template prepaid call from a patient at the Maryland Rehabilitation Center.
Finally, Adnan was going to get on the phone with me. Adnan? Hey, it's Sarah.
Hey, Sarah.
So let's just cut to the chase. Did you have any idea you'd be leaving the PT office heading straight to the hospital?
Nah, I had been in really good shape up till that point. I ran like 5 days a week, played volleyball until my back started hurting. I went to the doctor and he didn't seem concerned. He told me to take some NSAIDs like ibuprofen, rest, and go see a PT for advice on back pain. I had had back pain before from playing volleyball, and I just assumed that was the same thing, so I didn't think anything of it. But I took ibuprofen for about 2 months, and it wasn't helping at all, so that's when I decided to go to PT.
The doctor didn't think anything about your presentation was slightly off? Did he seem concerned about your health?
I mean, I don't remember exactly what happened that day at the doctor, but I can say with about 99% certainty that he didn't seem concerned. It just seemed like all the other times I had back pain.
We are going to pause again for another message about one of our sponsors. Do any of you hate lifting weights as much as I do? I can never motivate myself, plus they're so expensive. TheraBand is a great company that has so many options for healthy activity. They specifically have a first step to active health kit, which is amazing. This kit provides the tools needed to feel healthy and stay fit at any age. It's a multi-component, well-rounded exercise program, including strength, including balance, flexibility, and cardiovascular activities designed specifically for older adults to exercise at home, but any age can use this. The first step to active health kit features a TheraBand resistance band, color photos, and easy-to-use instructions. The program manual includes behavioral change tools, including goal setting, social support, and active choices. To get free shipping on your order, just enter the promo code SERIAL on their website. Now, back to the podcast. A little while after our phone call, I decided to try and call the doctor Adnan used to see. His name is Jay, and after several refusals, he finally decided to speak to me. Let's give him a call. Jay?
Hi.
So, it's true that Adnan used to be your patient, and he came to see you before you referred him to physical therapy?
Yeah.
So, we all know Adnan is now at the Maryland Rehabilitation Center after a serious medical complication. What did he look like when you saw him in your office?
Honestly, he seemed fine. He was pretty young, only 38, and complaining of not being able to jog because his low back had been hurting for the past couple of months. He had come to me before for back pain in the past.
Were his vitals or anything else off?
I don't remember the specifics off the top of my head, but let me check his chart. Okay, yeah. He was a little overweight, but not bad. He didn't report any nausea, sweats, fatigue, shortness of breath, weight loss, fever, bowel or bladder problems. He had intact dermatomes, myotomes, and deep tendon reflexes. So it seemed like a basic musculoskeletal issue to me, and I decided to refer out to PT.
So, to be clear, you didn't do any diagnostic imaging, and the chief complaint was low lumbar pain of 2 months' duration.
Yeah, look, I see a lot of patients who appear way worse off than Adnan did. I did what I felt like was the best decision in the moment.
Did you palpate his abdomen?
No, he was complaining about back pain.
Do you recognize that if you had palpated his abdomen, you would have felt a strong, prominent, and non-tender pulsatile mass, and you might have been able to resolve the problem right then?
Yeah, it was a mistake.
There was one person I still wanted to know more about, the physical therapist who saved Adnan's life. I got a hold of Aisha again to get her perspective on this modest hero. Hey, Aisha, what can you tell me about the physical therapist that you saw?
Yeah, she was great. I mean, for me personally, she double-checked my diagnosis of HMS through some fancy diagnostic tests called Baton-Hicks ligamentous laxity screen. She communicated with my rheumatologist to align my pharmacological management with my physical activity prescription. I trusted her a lot, so I wasn't that surprised when she picked up on Adnan's condition.
I decided I wanted to get Adnan's opinion regarding his physical therapist as well.
Yeah, the PT was great. We went through my entire history and reviewed everything. I had worked with them before for my back, so I was used to all the questions. I did not have anything in my medical history to cause concern besides smoking about 10 cigarettes a day.
Would smoking cause what happened with you? What did the PT discover that day?
Yes, I had been educated after all of this that smoking is definitely a risk factor, but so is older age, and I don't consider 38 to be that old.
What else did you do in your physical therapy session before the therapist decided that you needed to see a doctor?
She asked about my pain, which at the time was constant and it even woke me up at night. And it didn't matter what I did, I could not get comfortable or make the pain any better. And she had me move around to see if it changed the pain at all, and it really didn't. The pain was just really bad. But she did say that she didn't see it making me limp or anything like that.
What did she make you do when she had you move around?
She had me lying on the table on my back, and then she had me lift my legs up, and then she had me do a test called the slump test, but nothing really made the pain change. Then she had me flip over on my stomach and was feeling the muscles on my back just to see if she could figure out what was going on. She was kind of quiet and had me flip over and felt the muscles on my abdomen and asked if I had ever noticed a sort of heartbeat in my stomach.
Wow, what was going through your mind then?
I don't know. I was definitely confused and starting to worry a little. This wasn't how my therapy sessions usually played out. The PT explained she was concerned with what she felt when I was on my stomach and on my back and did not think that physical therapy was the way to go for this. She said she thought I should go back to the doctor as soon as I could.
Wow, and that's when you ran into Aisha again?
Yeah, I had met her when we were both heading into the clinic that day, and she must have seen that we were having a pretty serious conversation since the clinic is in a big open gym. But you could tell that I was really worried as I was heading out and offered to give me a ride to the hospital once I explained what was going on.
So what happened when you got to the hospital?
Well, the therapist had contacted them when I was on my way, so they took me straight back and did an ultrasound and found I had a 10-centimeter abdominal aortic aneurysm. 2 days later, I had surgery.
So what would have happened if the physical therapist had not decided to do that extra questioning and examine and had just treated you like you always had for normal back pain?
I don't even want to think about what could have happened. They told me 10 centimeters is pretty large and it could have ruptured, which is just terrifying to think about. What if the PT hadn't thought to check for that?
After all this detective work, I want to point out something I never really thought about before I started working on this story. And that is, it's really hard to account for the specific details of your time. So how well did Aisha actually remember Adnan? And how much has just been fabricated in her mind? How easy was it for Dr. J to miss an obvious step in his examination process? It's easier to forget than you think. Think about it. Who sat next to you on the bus last Tuesday? Were they tall? Was it raining? Are you sure? Did you fill up your water on the first floor? If so, which fountain? Who'd you talk to? Now recount every detail of your conversation. I mean every single detail of every day. It's hard. For these patients and doctors, recounting specific details is hard. It can cost lives. Luckily, in this case, the right examination steps for both Aisha and Adnan were taken. It saved Adnan's life. So next time you examine a patient, remember this story. Whether they have hypermobility syndrome or an abdominal aortic aneurysm, the extra time and care it takes to think through differential diagnoses may just save a life. I'm Sarah Koenig. Thanks for listening to Serial.